Nothing is more precious than our eyesight. Our eyes allow us to enjoy the beauty of the world around us. So much of what we learn, what we experience, and what we enjoy comes to us through our eyes. As you look at the world around you, think of how valuable your vision is. Refractive errors prevent the eye from properly focusing light, which causes blurred vision. The main refractive errors are nearsightedness, farsightedness, and astigmatism. And they are the most common reasons for why patients visit eye care professionals. Refractive errors are typically treated with eyeglasses or contact lenses, or they can be permanently treated with LASIK and other vision correction surgery. Imagine waking up and instantly seeing the details of the world around you without having to depend on glasses or contacts. With LASIK refractive surgery, this dream can become a reality for those who are nearsighted, farsighted, or have astigmatism. LASIK isn't what it used to be. Diagnostic techniques have advanced dramatically over the years, and the surgical technology is now more precise than ever before. During the procedure, a laser is used to reshape the cornea, where light enters the eye. This corrects vision by changing the cornea's shape so that light is properly focused. The procedure takes only minutes, and most people can go to work the next day. As with any surgery, there are risks and limitations, and our team of LASIK specialists can review these with you. When you enter the room where your LASIK surgery will be performed, you will begin by lying down on the procedure bed. Next, anesthetic drops are applied to numb your eyes. The surgeon will then position you properly under the laser machine. A device will hold your eyelids open so that you do not have to worry about blinking or closing your eye during the procedure. The LASIK procedure consists of 2 steps. The first step is creating the flap. To do so, your doctor will separate the outer layer of the cornea, the clear front window of the eye. Your doctor will then gently lift this flap and hinge it back out of the way in order to expose the deeper layers of the cornea. At this point, you may feel some mild pressure over the eye and your vision may dim and become blurry. The second step is performed by a laser that will reshape the cornea for your specific prescription. You might see a blinking, fuzzy light. Your doctor will ask you to look straight ahead in order to precisely align the laser beam with your eye. When everything is just right, your doctor will activate the laser. Computer-controlled laser light pulses will remove microscopic amounts of tissue, gently reshaping the cornea. The pattern of laser treatment is determined by a sophisticated program and based on the detailed measurements that were taken during your preoperative examination. The laser light is invisible, but you will hear a slight clicking sound as the laser gently reshapes your cornea. Because your eye will be numb, you will not feel the laser, although it is normal to smell a faint odor at this point. Before you know it, your procedure will be over, and the surgeon will gently reposition the flap, smooth it with a special medical sponge, and allow it to dry for a short time. You will receive a shield or sunglasses to cover your eyes so that you do not accidentally rub them. Ask us if you have any questions about the LASIK procedure. After the LASIK procedure, you will rest for a bit, and typically you can return home soon after. It's important to understand that after the surgery, you may feel a temporary burning or itching sensation in your eyes. You should also expect some blurry vision and haziness immediately after the procedure. However, your vision should improve by the next morning. Your eyesight should stabilize and continue to improve within a few days, although in rare cases it may take several weeks or longer. For most people, vision improves immediately, and you may be able to go to work the next day. But in most cases, a few days of rest is necessary. It is usually recommended to stay away from strenuous activities for at least a week. These activities may include heavy lifting, exercise, or tasks in dusty environments, which can traumatize the eye and affect healing. Generally, you will return to see your eye doctor or surgeon the day after surgery for a follow-up exam. As with any other surgery, always follow your doctor's instructions and take any medication prescribed. It also is important to refrain from rubbing your eye, as there is a small chance of dislodging the corneal flap. In most cases, LASIK is pain-free and can be completed within minutes for both eyes. Your eyes and your vision are as unique to you as your fingerprints, and no two people are alike. Yet, until recently, two people diagnosed with the same prescription would be treated the same. That's because glasses, contact lenses, and conventional laser surgery only address vision problems known as lower-order aberrations, which include such conditions as nearsightedness, farsightedness, and astigmatism. They do not address vision problems caused by abnormalities called higher-order aberrations, which are unique to every eye. Higher-order aberrations can result in visual symptoms such as halos, starbursts, and glare, and typically cause problems for patients while driving, especially at night. Now, an advanced form of laser vision correction, known as wavefront or custom LASIK, takes both lower and higher order aberrations into consideration and delivers a treatment that is based on each eye's unique vision fingerprint. In addition to correcting lower order aberrations, the custom LASIK procedure can help improve satisfaction with night vision by reducing the risk of glare, halos, starbursts, and ghost images. This procedure is the most advanced form of laser vision correction available today. When we are young, the lens inside of our eye is extremely flexible and allows us to easily focus on close objects. Over time, the lens gradually loses its flexibility, which makes it difficult to focus on close objects. This condition is called presbyopia, and it is a normal part of the aging process that happens to everyone, even those who have never had a vision problem before. In the early stages of presbyopia, most people have difficulty reading small print, such as on a menu, a cell phone, or a newspaper. People usually compensate for this by holding reading materials further away, and in some cases, by using additional light. As the condition progresses, most patients are unable to hold printed materials far enough away to see them clearly. Patients will often complain that their arms are not long enough anymore. At this stage, most patients will require some type of near vision correction. Because the lenses inside our eyes continue to change over time, it is important to see your eye care professional regularly for routine eye examinations. Monovision is a strategy that addresses the problem of presbyopia, in which people over the age of 40 begin to lose their ability to read or see up close. Monovision is a technique that involves correcting one eye for distance and the other eye for near vision. When both eyes are open, the brain learns to use the distance-focused eye for distance viewing and the near-focused eye for near viewing. Many people get used to monovision right away. Others feel a little imbalanced at first, but get used to it within a matter of days or weeks. In some cases, reading glasses may be necessary for reading fine print or viewing very small objects. A small percentage of people cannot make the adjustment to monovision and are better off not choosing this approach. Your doctor will perform a series of simple tests to determine if you are a good candidate for monovision correction. Monovision is available in a variety of methods. The most common approaches include contact lenses, refractive procedures such as LASIK, conductive keratoplasty, and cataract surgery. Learn more about monovision correction and discover which option is best for you. LASIK is a popular procedure with very high success rates. Most people see positive results from LASIK surgery quickly, but every person responds differently. Your vision may not be perfect immediately following the procedure, and total healing occurs over many weeks and even months, and usually takes longer for farsighted patients. It's normal to have blurriness, light sensitivity, tearing, and mild discomfort right after surgery. Additionally, one of your eyes could heal faster than the other. By following your treatment plan and attending follow-up visits, your eye care professional can make sure your healing is on track and will address any of your concerns. Dry eye syndrome is common after LASIK due to decreased tear production. Your eye care professional may recommend lubricating eye drops or other treatments to help relieve your symptoms. It is common for people who get LASIK to experience halos, glare, starbursts, or ghost images when looking at lights at night, but this is usually temporary. Infection or complications in the corneal flap created during LASIK surgery are rare, but possible. There's also a chance that your eyes will heal differently than expected. Not everyone who gets LASIK will achieve perfect vision, and you might still need contacts or glasses. You may even be eligible for an enhancement procedure to fine-tune your vision. It is important to understand the risks and benefits before undergoing LASIK surgery. Let us know if you have any questions.
Now, let's try a short 10-question quiz to see how well you understood the information in the program. Please circle true or false on your answer sheet. 1. True or false? LASIK will permanently change the shape of your cornea. 2. True or false? There are no guarantees as to exactly how well you will see after the procedure. 3. True or false? You may experience side effects such as haze, glare, halos, light sensitivity, and dryness of the eyes that may not go away completely. 4. True or false? All eyes are capable of seeing 20/20 or better. 5. True or false? After the surgery, follow-up visits are not important. 6. True or false? There is the possibility that another operation may be necessary after the initial procedure to obtain the best level of vision correction. 7. True or false? It is possible that you might still need to wear glasses or contacts, or that LASIK could cause loss of vision. 8. True or false? You may experience mild to moderate discomfort for several days after the procedure. 9. True or false? LASIK will eliminate your need for reading glasses when you're over 40 years of age or presbyopic. 10. True or false? The program that I watched covered all risks, side effects, and complications that could possibly occur either now or in the future with LASIK. When you have completed this quiz, please grade your own test by comparing your answers to those found on the bottom of the page.
As part of the preliminary process prior to surgery, patients are asked to sign a surgical informed consent form. This form explains the procedure itself, its possible effects, and all the potential problems that may occur during or after refractive surgery. Signing this form is the patient's verification that all of these potential complications are understood and accepted, and the patient still wishes to continue with the procedure. If questions arise after reading the informed consent, the patient should ask for clarification of all issues before signing the form.
If you need additional information or would like to watch any segment of this program again, please ask a member of our staff for assistance. Thank you for your trust and confidence in choosing our clinic for your vision correction needs.